Hi, so I go by Chris or Dr. Scott, however people want to address me. And so I am a psychologist in the Pearland area, and I've been practicing for about 12 years. I have a private practice, so I'm just south of Houston, and I specialize in working with couples and relationships. I'm a GOTTMAN certified couples therapist, which means that I have specialized training in working with couples. And I actually finished up my Shaw sex therapy certificate in 2021. So I'm really excited to be back and connecting with my Shaw family. And I'm in the process of applying for ASEX certification. So I do sex and couples therapy in my practice, and I specialize in working with folks who identify as LGBTQIA, ENM, and kinky folks as well. I'm going to be presenting on inhibited sexual desire discrepancies, and using Gottman method techniques for helping bridge that gap. And what got me into this was, so I was originally trained as a couples therapist before I was trained as a sex therapist. And I saw so many times I would have couples come in with inhibited sexual desire discrepancy concerns as at least a secondary concern, if not a primary concern. And the traditional way you're trained to work with folks in couples therapy is really by building up the relationship. So you work on conflict management and listening skills and building emotional intimacy, which are really great components, but it's really lacking the sort of the psychosexual skills and the techniques to make that work. And so there's some problems with that model. Now, as a sex therapist, you focus a lot more on training around the psychosexual skills building. And when I found working with couples and I kind of rush too quickly to the psychosexual skills building piece, that oftentimes there's just not enough good trust and communication in the relationship, and the motivation to follow through is poor, or there's just additional conflict generated when the sex therapy homework, for instance, is not going well. And so the objective in my presentation is really to kind of blend those two worlds, the sex therapy world and the couples therapy world, and take some of the standard Gottman protocols around sexuality and actually put a twist on that, and show maybe a few things that are a little bit different than folks in either of those worlds have seen. Well, I think one is to see kind of the strengths and weaknesses of both the standard sex therapy approach, like the implicit model when working with couples, but also some of the strengths and weaknesses of sort of the traditional couples models as well. And then to come away understanding the basics of how do you do Gottman therapy and sort of the structure of that, and how you could use some specific techniques with couples to create a safe environment, and one where they can explore their life dreams around their own sexuality and open up around that, as well as then start to integrate specific homework assignments that we would do using like standard implicit model, where we use the intensive therapy component. Well, I think probably the biggest thing is being able to reconnect with some of my fellow Shaw students as an alumni. So that's something I'm really excited about. And also there's some great presentations on both days. And I saw on like day one, there's some great presentations on like consent and around Black women's experiences trying to seek out sex therapy, and those really intrigued me, and I'm really excited to kind of see those, as well as all the other presentations. There's a lot of great ones out there that I want to see, but those kind of hooked me, and I'm like, okay, I gotta, even though I'm presenting on Sunday, I really want to get started early on Saturday and see some of those initial ones.